ready now. You want to get the scissors?
Yeah.
I started getting sick in my 30s. I started having really, really bad chest pain.
Here we go, a flower for you.
Oh, it's so beautiful. I just had been ignoring it because I thought, you know, I'm only 34 years old. I can't be having heart problems. But one evening, I sat straight up in bed with the worst chest pain. So I went into the hospital and they told me I'd had a heart attack. I was 35 at the time and was scheduled for open heart surgery. And I thought, once I get this, I won't have the blockages anymore. You know, they'll actually fix it. Little did I know that it was followed by years of the same thing over and over and over again. A heart cath, get another stent. Heart cath, get another stent. Until my doctor said to me, I don't know what else to do for you. There's nothing else I can do.
Contrary to what most people believe, getting a stent in your coronary, if you have stable chest pain, will likely relieve your pain, but it will not help you live longer, and it will not protect you from having a heart attack. It only reduces symptoms. And the problem is that some of those procedures will lead to bad outcomes.
I'd started doing research about where in the United States do I have to go to get the best heart care. And ironically, it was only 2 hours away at the Cleveland Clinic.
How are you?
I am great. Look at the thinness.
I know, you look really good.
I have lost, since last year, I've lost 21 pounds.
Oh my God. Yvonne came to see me when she was sort of at her wit's end. She had had bypass surgery at an early age, 27 cardiac catheterizations, and well over 7 stents. Deeper. This is just an unbelievable amount of stents and cardiac caths. I'm sorry, it's gonna get pretty tight, huh? Oh, sorry. I can't tell you how shocked we were when we saw her the first time. Because here was a young woman whose diabetes was not well controlled, her cholesterol was never well controlled, and her high blood pressure was never well controlled. Breathe normally for me. If someone had talked to her, I think someone had really teased out her chest pain and her shortness of breath, I think many of her cardiac catheterization and stents would not have been necessary. You know, you have all these stents, and you know, these stents, once they go in, they never come out, and they're part of you. Now we're kind of dealing with the consequences. When you reward physicians for doing procedures instead of talking to patients, that's what they're gonna do, is do procedures.
The vast majority of doctors in this country are paid by a fee-for-service system. And that simply means that they get paid for each office visit. If they're surgeons, they get paid for each procedure. If it's a radiologist, they get paid for each CT scan that they deliver.
If I spent 5 minutes with you and then put in one of these stents, I'd probably get paid $1,500. For me to spend 45 minutes on an established visit with a patient to make sure they're doing their exercise, make sure their diabetes is going okay, and to try to figure out what their true problem is, probably get paid $15. It's a completely irrational system.
Fee-for-service rewards physicians for doing more. It doesn't reward them for doing a better job. It doesn't reward them for keeping their patients healthy. It rewards them for delivering more care.
I was trying to figure out how much Yvonne's care would have been over the years, and I think it's well over 1.5 million. But it's more than cost. It's just so much more than money. The psychological trauma of every one of those multiple cardiac catheterization, every time she had a chest pain coming into the ER. And unfortunately, there are lots of Yvonnes out there.
Although we've made progress technologically, you know, we know how to do things for diseases we couldn't have done before, we haven't really experienced the systemic improvement that we want, the new healthcare system that we're really after. We We pay for fragments of care, a doctor visit, a hospital stay, a lab test, an ambulance trip. So because we pay for pieces, we get pieces. And so people who really need a coordinated system, they don't get that.
Medicine is very siloed now. Medicine is very specialized. And this is really a big problem when you go to the hospital, because there are so many different people who lay their hands on you. And if they're not talking to each other, you can't necessarily get the right diagnosis. You can get repeated tests. You can get things happening to you that put you in harm's way because nobody's really keeping track of you as an individual patient. A recent study found that 187,000 patients die each year from harmful care in the hospital, which includes medical errors and deadly infections. Based on these numbers, this would be the third leading cause of death in the United States, just after heart disease and cancer.
Hello, Dr. Ross. I am back in the chest pain center with a pretty sick patient, and I'm going to need you to call attending phone 2. The emergency department is the safety net of health care. We see a lot of the chronic conditions that affect many Americans that have gone untreated for sometimes months, but sometimes years. And of course, the natural endpoint is going to be in the emergency department. Let me just take a listen to you. It would be so wonderful if their chronic health conditions could be prevented through effective primary care.
There's a saying in healthcare policy that 20% of the patients account for 80% of the costs, and the majority of those costs are when they're repeatedly hospitalized. They're patients with heart failure, they're morbidly obese patients, they are often poor patients, but not always. One of the ways to think about saving money in healthcare is to focus our energies on that 20% of patients and think about treating those people in a more effective way.
I just want to review this pain. It's
Right
here,
in there,
right in
yeah.
the center
Right
of
in
your
my chest,
chest,
yes,
okay?
ma'am.
And is it still traveling
It's
into your
traveling
neck?
down my arm, my neck, and my head and ears buzzing and ringing at the same
Okay.
time.
What was it, Mr. Litton, that finally made you say, okay, that's it, I'm going to the emergency
Well,
department now?
see, I've been to the emergency department a few times before, and the last time I was having chest pain, not like this, it's a lot worse. They sent me home with them.
How long ago was that?
That was, what, a month and a half ago? When I had my first heart attack, I did the cardiac catheterization, put the thing up there, and then put a stent in my heart because I had a clogged artery. And that worked for a while. I mean, a couple weeks, I felt like I was okay. And then all of a sudden, I started getting chest pains again. So here I am going in and out of hospitals, finding out what's going on.
Do you have any eating habits that you think might be?
I eat the regular food and stuff.
What's regular food?
Eggs, sausage, grits, bacon.
Well, what do you think about
Or a
your
healthy
diet?
diet?
Yeah.
Yeah.
What do you think about that?
I'd eat if I had to, but
If you had to? Well, you have a stent in your heart, right?
yeah.
All right, and you've had heart attacks, and you're here today with chest pain.
Yeah.
When do you think it would be good to try it?
Once I found out what's really wrong with me.
We've become a culture where you drive up, you get what you want, you get it fast, you get it right away, and you drive off. And that being applied to healthcare just doesn't work. Most diseases don't happen overnight. Sometimes they're related to lifestyle habits. Sometimes it's related to what the individuals actually have access to.
I have no health insurance. If something happens, I gotta go to the hospital. And that's the only health care I ever got. I never had a personal doctor, family doctor, nothing, all my life. I stopped taking my medicine months ago because it's too much, can't afford it. If you go out and buy a heart healthy diet food, it's gonna cost you more money than anything.